Hello, everyone. My name is Kara Canuck, and I am one of the co-owners of Des Moines Mom. And today we are doing a conversation on concussions. This is the time of year where football is kind of going and getting started, and sometimes, we start seeing things in the news about concussions. And so we are joined by Jill Bellis, who is going to help us understand concussions a little bit better. Jill, can you tell me a little bit about yourself?
Sure, yeah. Again, I have been a physical therapist for about 23 years now, and worked at Blink Children's Hospital even before that, before I went to PT school in the pediatric intensive care unit. Um, and as I kind of started out as the outpatient therapist, I kind of gravitated towards the inpatient side in seeing a variety of kids from the neonatal intensive care unit to all the way to the pediatric intensive care unit. And anywhere in between general pediatrics, hematology, oncology, and have seen a variety of our brain injury patients from the very mild and concussion patients to more severe.
Very good. Well, I know that I mentioned football and, looking for concussions there because I think, in the news you see that a lot of the times. But honestly, concussions can happen at any time, regardless of what maybe sport you're being involved with. And you can get a concussion just in life. So if you are, you know, wondering if your child might have a concussion or somebody else in your life, what are some common concussion signs or symptoms?
Yeah, and so if you do have a child that has had some type of impact, some of those symptoms are just a general headache. You'll have possibly some dizziness or even nausea, vomiting can occur. You can have some visual symptoms, blurred vision, double vision, possibly like a light sensitivity that can occur. You can have some balance deficits with maybe more clumsy or tripping, just kind of not where they would have been. There's also just a general fatigue or sleepiness. Just I'm not quite right.
Mhm.
Sometimes patients will describe a fogginess where they just cognitively can't keep up or kind of take in what kind of is going around them, and then they just kind of shut down a little bit. If they're seeing just even differences in their personality, like I'm um, very labile, or I get a little bit sadder than I would, or happy, or I'm more excited than I would have been, like kind of that nervous play. Just a lot of things that kind of go into um, those little symptoms. And really, if you're seeing just any change, you really want to um, get to a medical professional and kind of get those things checked out.
How long can some of those signs or symptoms last for?
They can last quite a while, actually, even
Mhm.
even on our mild kiddos that
Mhm.
um, technically a concussion is a brain injury. So um, that mild injury needs time to heal. So with those symptoms, basically with that healing process, we just watch and challenge what that symptom would be, um, and give that brain time to rest.
Okay. Very interesting. Because yeah, some of those things are last a lot longer and you
Right,
just
and then there's a wide variety of ranges, and in the sports realm of it, they have a return to play policy,
mm,
and you're just automatically out if you have any of those very first symptoms of a memory loss, or some of those dizziness symptoms. You're just automatically out, and then they have their own grid of here's our return to play policy, but a lot of times kiddos can't even last longer than what the schools are looking at, what the state recommendations are. um, and so it's really something that we need to kind of look at a little bit with parents and with the kiddo in really being honest with your symptoms
Yeah.
and knowing that letting that heal now is going to make a difference later so that we don't have one on top of the other.
Right. No, that's super important. There is a saying, something about like an ounce of prevention, which I
Hmm.
can't remember what the
Exactly.
saying is at this point. That's typical for me. But
Right.
the best care is prevention. So can you give me some tips on how to prevent concussions and those injuries?
Sure. Yeah. And obviously, you could wrap your child in bubble wrap. That would be fine with me. That helps a lot. But if we're going to live in the real world,
Mhm.
using that prevention as far as helmets.
Yeah.
When we have wheels under our feet, we have a helmet on our head. So that means even your 1 year old on their little trike
Mhm.
that you're pushing down the street, we're still starting that practice early because we want to really instill that into them that that is something that we need to do for safety to protect our brains and make sure that we are always, anytime that we're on our rollerblades, on our scooter, and as we get older and we're buying the electric scooters that go like 60
Right.
miles an hour,
I
we
know.
we need to wear a helmet.
Mhm.
Um, and a very good fitted helmet. But then there's other ways that we want to make sure that they're going to stay safe, even um, being in the properly fit car seat and facing the right direction in a car can prevent that. Um, Using our seatbelts, obviously, all the time, but recommendations are anyone 12 and under are in the back seat of the car as well, and in their seatbelts. And then, just watching and removing any hazards that would be around in your house or, you know, trip hazards, things like that that could cause an accident. So, but really, most importantly, use your seatbelt and wear your helmet.
Those sound like pretty good life rules. I think
Right? I think so too. I think so
my
too.
son has one of those electric scooters that you talk about, and I'm sure have seen several injuries as a result from. But
It's
we
kind
have
of
a
our
very,
new uptick in injuries, actually.
yeah, we have a very firm rule that if I catch him on his electric scooter without his helmet, he is grounded from his electric scooter, and that is just what the rule is.
Good momming there. Love it. I love it. High five.
Okay, one other question for you. What types of things are you seeing as, or like what types of activities are you seeing as a result that are resulting in a concussion? Do you have any like patterns or anything that you've noticed?
Um, well, like I said, we have an uptick in that electric scooter issue
Mhm.
there. Um, and really, we get more severe head injuries from a motor vehicle accident.
Okay.
Um, but yeah, really, it's bike riding, it's the scooters, just watching and being safe,
Mhm.
because you don't know when you take off from your house and you're hauling your baby and your burly that somebody's going to pull out in front of you or that you're going to wreck and just topple over. Sometimes that can be
Mhm.
damaging to your child and maybe not even you, because they're just at that certain point of
Yeah.
where they are. So and then right now it's fall time, so we're going to get a lot of those concussions from football.
Yep. Yep. All right. Because again, I ask these questions to be like, okay, are there things that I can do to prevent, concussions and head injuries in my own
Right.
children's lives? So it,
Yep.
it does sound like, bubble wrap is probably the way to go.
Yeah, I think so too.
Okay. Well, Jill, thank you so much for your time today. You've been very helpful in educating us about concussions, signs to look for, things that we can do to help also prevent concussions in our lives and our children's lives as well.
Yeah, you're welcome.
Thanks.